I'm delighted to introduce to all of you Professor Nuria Fuentes-Pelaez, who I admire tremendously. She's a full professor in the Department of Methods and Diagnosis in Education at the Faculty of Education, University of Barcelona. She leads the GRISIJ research group, focusing on social educational interventions for at-risk children and young people with child protection systems within. Her studies contribute to areas such as foster care, adoption, family reunification, and parenting support through group social educational programs alongside collaborative research methodologies. She's actively involved in several esteemed national and international scientific networks, such as USARV, and it's a member of the executive board of the Institute of Research in Education and the Biomedics Committee of the University of Barcelona. Her advisory roles extend to prominent consultative bodies such as the Observatory for Children at the Generative de Catalunya and the Municipal Welfare Council of the Barcelona City Council. These roles underscore her influence in shaping research and policies related to child protection and social educational interventions, demonstrating her commitment to improving outcomes for vulnerable populations through rigorous research and effective practices. Nuria, we are delighted to have you here with us, and the floor is yours. Thank you ever so much.
Thank you so much, Vanya, for the introduction and for the presentation, and also thank you to invite me to share during this space what we are doing in the research group GRISIJ. That I saw the translation on the screen. That means it's an acronym, so it's sometimes very difficult to pronounce it. So it's an honor to have this time here. Let me check if it's working or not. It's not for you. Yeah, I don't. Probably it's true. Yeah, let me. Nah. As you noticed from my accent, I came from Barcelona. Barcelona is a wonderful city, so everybody is welcome to come, and also is where we have the university, the oldest university in Catalonia. And the University of Barcelona has different campus, so we are not in this very beautiful building, but you can also visit. We are in the campus of Montet, that this is next to the mountain. So we are in the Faculty of Education and in the Department of Research Methods. And our research group has three main lines of research. The first one, and this is the one that with the one we start the group, is prevention and participation in child protection system. But we also developed two more lines. That one is positive parenting interventions from the perspective of socio-educative programs, as well as the promotion of psychological and health well-being. So sometimes the projects are not only fitting one line, they are mixed with the different lines. And then we have two different axes in that are transversal axis. One is children's rights, and the other that we include in the present years, it's intersectional gender perspective. So I prepared so much material. So please stop me, and also if there is any question, feel free to ask during the presentation, and also to try to let sometimes at the end to talk about, because I'm also interested to know your opinion, questions, and think about it.
Can I ask a question? So you're saying the agenda spans from universal childhood to particular subgroups around care. expand universal and very targeted services for children.
Yes, 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 yes. So we are not only focused on kinship. So we also did research before with the children before to get into the system. So at the beginning when we start in 1995. So we are 30 years this year. So many years. The Professor Pera Amoros was the one who built the group. We started with foster care and with adoption. So the main research that we have doing at that time were specific for these two groups. But after the years, so one research towards another research, we realized that there was specific groups inside the system that needs also attention. And one of these was the kinship foster care. So we did a big assessment and evaluation of the foster system in Spain from 1997 to 2003. And there we found that the kinship foster care were the measure with less attention in the system. And so we moved towards kinship foster care. And after some researchers focusing in kinship foster care, we also moved to biological families. And now we still maintaining, we go to the first, trying to work with the families as well as with the children before to get into the system, because so it was this kind of path. But why I bring kinship now for many reasons, but some of the reasons is because when I want to share you why in our context, and also trying to share some results that we have found in research that we have made some years ago about difference between kinship and non-kinship. The last point, it's about quality interventions. So I'm not going to have time to go to the assessment I just mentioned, and there is an article. So if anyone is interested in information, it is in the article. I would like to focus more in the support group because it's what we are working now. So nothing new. Children's rights, major number of children placed in it, and benefits and challenges. So I think it's important to think and to remember that kinship foster care at international level, the guidelines and also the laws that said that it should be the priority. Also, we've got, of course, this in Spain as well in Catalonia, but there is a point that goes directly to the assessment that it's on the bottom of the airport that it could be or it should be always the first if the family meet the appropriate conditions for foster care. So I think this is a very, very important thing about it. And also open a lot of questions. What does mean meet the appropriate conditions for foster care? So one of the questions that maybe we can. And what about our context of what happens in Catalonia as well as in Spain? So Spain has different communities, autonomous communities. So each community has the competencies to organize the child protection system, but always under the umbrella of the state of Spain. So in Catalonia, and this is recent, so they are from November, these numbers, we've got 8,561 children out of home in care. It's a lot, but that means that we are going to find 6 every 1,000 children, 6 will be under protection in Catalonia, and this is 6 per 1,000. And as you can see, we've got more boys than girls. We can. I'm going to show you later why this should be, and also if you look at the ages, the big number of the children or the youth are between 15 to 17 years. Regarding to the two big alternatives, residential and foster care, we're still having more in residential than in foster care. We're still having more.
Is that true across Spain?
No, almost. It's a very good question. Why is it different in Catalonia? Because this is in Spain. If you can see in Spain, the red one is the foster care, and the blue is the residential care. It's almost, but it's a bit, but it's not exactly the same. So Catalonia has the particularities in, and what these particularities should be. I will later. And the other thing that I will also show here is the different types of foster care that we've got. So we've got temporary, emergency, permanent, that it means long-term foster care. Also the placement before adoption. A bit more of the 60% of the placements are long-term. So that's also give a characteristic of the very specific characteristic. So we are not talking about temporary. So many of the children are in long term. That's like, you say, a marathon or a carrera de fondo. So something that starts, but it takes for long, many years. And also, if we look at what kind of families, so most of the families are in kinship foster families. So this is what happened.
And Nuria, do you have, are there other types of legal order for kinship care apart from foster care? Because here we have other routes to kinship care other than through foster care.
So we've got children. Well, the first thing is that our system is administrative. It's administrative. So it is the government, not the judge, who decides that the children has to get into the care. So the professionals assess the family, and then with this information went to the administrative government, and of course with the advocacy and everything, they apply the measure. And there is only a few cases that there exist that the judge intervenes, but most of them are administrative. So we have these two different. So we have residential and foster care, and in foster care we have both kinship and non-kinship foster care. And most of the non-kinship foster care in Spain are voluntary, are on voluntary basis. So we have the possibility of professional, we call it specialized, not with and to receive a salary, but at this time it's just introducing this situation.
So no salary, no payment for voluntary foster care?
For those who has so now it's possible, but there are really few. There are really few. For instance, few, I mean that 10, for instance, in Catalonia, 10 cases because it's like at that moment it's like a kind of pilot. Because
Okay. And can I just ask one more question about so the administrative decision is, so has the judge already decided about removal of the child into care, but the administrative decision is what kind of care, or the whole thing is administrative?
The whole thing. The whole thing. So this is really interesting because it's very different from other.
Yeah.
So it's
we used to have that.
Yeah.
Okay. Thank you.
Yeah. is the whole thing. So the judge intervene when there is an opposition from the family, for instance, if the adult
becomes an adult.
or the maltreatment by the intervention of penalties and things like that. But all of the cases of neglect and all of this go from administrative. Many of these gains or arise after a long set of intervention of the basic social services. So instead of being stabilizing the situation of getting better, sometimes it getting worse.
Yeah.
And the final solution would be to take a neighbor and take care. So it's something, I think that's why I said, so we have to, of course, we have to do research and look at what happens in the in the child protection system. But we should, first of all, think of, in my opinion, is that this child protection system it should be also include the previous step.
Yeah.
Because otherwise there will be something missing on the continuity of the children. So thank you for the questions. And this also trying to get evolution in Catalonia. I choose Catalonia because we've got with more details about the data into. So we have a report every month. So we have more update data from Spain. And if you can see at the graph, and this is quite okay to ask what happens. There are 3 lines that don't move, always more or less the same. In the orange is the productive placement. So these are the children who are going to pass later to adoption. The blue one is non-kinship foster care, and the green one is the kinship foster care. No movements, and this is something. What happens here? What happens here? Because we can understand the non-kinship that is more or less the same, but we should expect the blue one with a highest proportion and with more movements, because if this line is not increasing, so we are not going to overlap the numbers that I show you.
But the movements in the yellow line are huge.
Yeah.
But you'd think residential care would be fixed in scale.
Yeah, but why do you think the residential? So in fact you have to, so residential, it's so high, but also if I didn't split the 3 others, so it will be the numbers more close to the residential. So, but I was interested to make this separation to see how flat is it in every of the measurements.
I presume that the 3,000 is a big increase is new residential care. I thought maybe, but then it goes down again. So what's going on?
What do you think? Why did it go ups and down? I give you, remember COVID period? Reduce the residential, but why is it so big in Catalonia? Because we receive many unaccompanied children. Many and this is what the residential goes up. So we, if you saw without this information, you say, what happens in Catalonia? What happens? And that's why most of them are boys, because there are some girls that has also experienced this migration, but there are very few. And that's why we have these big numbers in the 50 in the rank 50 to 70. So I think this is an important also group that we should pay attention, although I'm not going to talk about this because we, to be honest, we didn't have any, we didn't done any research on this group. Of course, there are other people who is doing research on that, but this is a big issue in Catalonia too. So benefits and challenges about kinship care, it's very well known. So we've got the first studies from the latest 90s about reporting all of these kind of benefits, but also the challenges. And these challenges is one of the things that also I want to connect with the presentation. One is this lack of support and resources that also we noticed at the beginning of 2000, and also this challenge of methodological interventions, because some studies said that it's not easy to get evidence of the interventions that are addressed to the kinship families, because they are not evidence-based or practice evidence. So this is also an important point to reflect about it. So before to get into the interventions and how we can increase the quality, let me to share some results from a research that I have done with Carme Montserrat. That Carme Montserrat is from the group of MATA. So we are in different groups, but sometimes the groups also collaborate. It was a research that we have made some years ago, but I think that there are relevant results. I'm going to skip this part, but just so we analyze 930 cases, open files and closed files. All the files came from the same agency that operates in Catalonia, but as well in Balearic Islands. Of course, many of the results confirm what we know, so nothing new. But there were some particularities that are interesting, also to understand, for instance, these benefits, and also to orientate the intervention. One is that many of the children who are in kinship care are the first protection measure. So that means that when they need to get out of the family, they don't get into the open door was the kinship family, not the residential one. And this is, it looks anecdotic, but it isn't, because that means that the continuity of the children is higher than the children who are in the non-kinship foster placement. The other thing is that the long-term, so many of the placements are long-term foster care. So the reunification rates are really, really low. And also the temporary care also it's low. So in terms of support, we are going to have families whose children go through all the stages of development, and the kind of support that they are going to need will be also different, depending also in the stage that these children will have. So, because when we talk about foster care, we said, okay, that one of the roles that the family should do is to give this support, to give the attention, educated in a certain time of the life of these children. But the kinship foster families, this certain time sometimes is so long. For instance, the average is it was 6 years and a half. That means a lot in the life of the children. So
the kinship care is older.
Yeah, and
start with, yes.
So all the other things that we know, that they're older and so on. But they're older, but not as older as we thought, because these are in the first row. Because although they are grandparents, most of them, they are young grandparents. So they are older, but not as older as we are thinking about. And the other thing that also was interesting, so this is something that it should be studied more in depth. So there were no difference regarding neglect, so it was in both samples. But there was difference regarding the other types of maltreatment, physical abuse, psychological abuse, parental abuse, sexual abuse, and gender abuse, gender violence. What does mean that probably these children who are in kinship foster, so the kinship foster family knows the situation of the gender violence and protect and arises with this responsibility. So this is another point that it would be interest to explore. So we don't have more data on that, but it has implications for the support that you are going to give to the families as well, to the children. Another thing interesting is how is the relationship between the kinship and the father and the mother. There is no difference in regarding to the visits in general. What happens? Oh. Okay. There was no difference regarding to the visits without supervision, but there are difference in those visits or those contacts that include talking by phone or that. So when the children talk by phone with her mother or with his mother, father, most of them are in kinship, not in non-kinship. Also, those visits who has to be supervised used to happen with more frequency in non-kinship than in kinship. So this is another matter, also this relationship. Just some ideas of how the kinship foster families perceive the experience of kinship. So in both, so the orange is the kinship and the blue is the non-kinship. The satisfaction with the evolution of the needs is quite.
Explain that to me.
So how they perceive, how they perceive that the children is evolving. It's the development of the child.
Yeah. So
if they are satisfied or not, how they are growing in the child. Yeah. So if they are, so the satisfaction is higher, but it's very good because it's on the same line, but 1 point over. Sorry. Also, almost the same pattern, but regarding the perception of their skills to help the children, and there is only a point that there is not significant differences in the perception of skills to help the children to talk about the experience in foster care. So in that point, non-kinship and kinship are very close. So and have more skills, more information, it will be more easy to talk about the experience to be in foster care. But we found this and it is interesting. And the other thing that is also interesting is to manage the relationship with the father, but especially with the mother. But it's not, the thing is that it's not because the mother has a different behavior, it's because most of the visits are with the mother. And so they also change totally the profile in that. And of course, in the satisfaction with the economic allowance, that for them is really not enough. Finally, what happens with the end? If we look at the end, in those cases who are not closing, the expectation of the families is that the children continue living with them, higher than in non-kinship. And what happens when the second was from the analysis of the closed case? What happens is that more or less a bit more than half of the children live with them after the foster care finish. And the last one is also tricky because they are the reasons for ending the placement. And if you can see, when we ask to the professionals why the placement breakdowns, a high number of professionals said that it was because of the child behavior problems that the child behavior problems. But if we ask the same question in the Kinship foster care, they say it was because of the inadequate care of caregivers. Sometimes, the problem is where side you are looking for, from child behavior problems or from those competencies that don't have the foster caregivers to answer the needs of the children. So
do you think the experiences are different in the two groups, or the perception is?
I don't know. But it's something that also needs to because it's quite and also if we as we know from the research evidence that there are many benefits and how the families perceive themselves. So we don't know exactly, but it's something that I think that we should think about it. It's something that it telling us that is because of that, or there is the perception of the professionals that they look different to the families. Yeah. So it's something that I don't have, to be honest, I don't have the answer, but these numbers give us to think about it. So many evidence about these differences, and that I think that they have to think about it, how to conduct this assessment, and especially how we can give the support after the assessment. That's why I'm going to move very quickly to the question that I said at the beginning. What does it mean to meet the appropriate conditions to the foster care? So this is how the things that are involved in our context, because we got a child protection team that it comes from the specialized services, who is taking care of the intervention with the biological mother and father, and also with the children. And we've got another team that is the foster care team, who is taking care of the foster care families. And the second team is the one who has the responsibilities to do the assessment of the foster careers. So, questions about the assessment, and just like titles: assessing or assisting, or both. So, in my opinion, and also this is what we, this was the orientation that we, when we did this tool, it was include both. If we include both, that means that we don't have to focus only on weaknesses, also in strengths, and trying to build from the beginning this partnership. And of course, when this is the answer of a boy, when we were interviewing him about in our research, he said, "Why you are calling foster care to my family? Mm-hmm. It's my family." Mm-hmm. It was in a kinship, because he was, no, it's my grandmother, it's my family. So of course, the assessment, I think it will be different. And so we made a proposal to do this assessment. It was quite old, this article, and For sure, the proposal that we have made here, I think it should be updated. But what we do through a Delphi study, it was to identify the different areas that it should be addressed, the assessment, and highlighting the particularities. And according to the research that I have presented previously, I think that it should be reviewed. And these different areas were accompanied with a kind of a rubric. I don't know how to say a rubric. It was a qualitative evaluation telling from 3 different points how to identify different indicators. And the most important is that after the assessment, it should be designed a plan for accompany the foster families. So it's not only the matter if they are adequate or not, it's also how we can support them. So this is the question. Because always, and also the professionals think about, it is good enough? It is good enough or not? And what does mean it is good enough? And if we should if we should consider that this good enough should be built with the company process or with the interventions, then we move to the last point that is also quite long. So we built 2 different programs to give support to the foster caregivers as well to the youth in foster care. These 2 programs were built on the basis on a collaborative research with professionals, but we also with kinship foster families as well as the foster youth. These 2 programs are socio-educative programs aims to help to give them support and to develop competencies. And what are we working now is, of course, we are not working on the programs directly, but we are working trying to overcoming the challenges of good methodology that we have found in previous research, because that means that we believe, because we also have evidence that group works, so group interventions could make the difference in intervention with the families and also help them to increase the quality and this good enough that we are talking about. We understand these groups not from therapeutic view, so we understand from socio-educational learning, and that means that the participants or the foster caregivers or the youth, they have a real active role in the group, and is what we call programs of third generation, where they can participate, reflecting on their educational practices, and also to commit with the changes that they think that they should introduce in their lives. So the idea of these groups is that the learning is something more than a product of change. It is the process of change. We want to enhance with these kind of problems. And then the methodology is an experiential methodology where we introduce 3 different activities that help to the participants to go through the attitudes, but also with cognitive and behavioral dimensions of the learning. Both programs are designed to apply weekly. So the sessions are 2 hours each session. In the case of foster caregivers, there are 12 sessions. And in the case of foster youth, there are 9 sessions. And all of these, and then the program covers the different particularities of kinship foster care, and also introduce aspects that are related to the links with the community, as well as the reinforce of the foster caregivers. What happened? So the professionals identify many challenges to introduce the group settings in their activities. So they are very comfortable in the interview settings, so the one-to-one, but they found very, very difficult to run groups for many reasons, because they don't have the experience, they don't have been training about it. They feel more insecure inside in a group. So different things. But apart of this, we also they also tell us different. So in a previous research that we also have done, we identify challenges related with the motivation and commitment with the change of the participants, as less as the professionals perceive. Also to manage the diversity in a group. Also to manage the emotional, because you can imagine that although there is not a therapeutic group, emotions arise because they are, although they are not talking about their experiences, because the programs allows them to talk about the experience of other cases that are, for instance, that there is a connection, but also there are barriers related communication, for instance, to avoid manipulation or inequalities in participation. And they also find, they also tell us they don't have, so they've got the programs, but they don't have tools to know how the group is evolving and developing, and also how they can integrate the group work in the individual with the individual work. So with all of these challenges, we developed a previous research that try to overcome some of this. I'm building a model or a structure to help to overcome challenge or the previous challenge that I mentioned. So we built this model that we call the core model, and it's a model based on the benefits of groups, to be working with groups. The model is based on the literature review, and we identified 5 elements. The first one is engagement. So how to the engagement with the group, but as well with the learning process and the change process. The other one is communication, because all what happens in the group goes through communication and the interaction process. Another one is the group cohesion, how to work to facilitate this group cohesion, because once this group cohesion start to appear also, or this is the hypothesis, the mutual aid, it aroused, and finally the social support. So through this model, we built two tools addressed to professionals. One is addressed to help professionals to plan the groups, to make this configuration through a reflexive and dialogue assessment. And the other one are related to this group management and also to drive engagement. Inside the model, so we developed these 2 tools. It was P+Grupal and G+Grupal. That means P of participant keys and G of group keys. The first one is biggest and has three big dimensions. That one is communication. The first one is communication, engagement, and personal circumstances. And the aim is to help the professional to assess the participants, to obtain relevant information, to configure, to build the group. And trying to make an equilibrium between heterogeneity and homogeneity, because we know that the group are working better if they are not so homogeneous. So the contributions are at the initial assessment, because this is our hypothesis of what we try to we are also collecting data, is trying to reduce the dropout of the group. That's mean that is that the second is this situational assessment, and this is really important, because this assessment, that means that for instance, one person is not so it's something that it should be reassessed. So it needs to understand that the situation the decision to participate in a group or not participate in a group, it should be related to a particular situation of the life of this person, and not for always. And then with this initial knowledge, it could be work on the dynamics, so to anticipate what would happen in the group, as well as to prepare a plan to help this participant to participate in a future group. So there is also a qualitative, because we have indicators of favorable, less favorable, and unfavorable, and in these 20 subdimensions. Here, just to have an example of that, and when it could be used. So we propose that it could be used at the beginning, for instance, when someone is going to you got used in the second point that most of the people are using in that point, is if I'm going to plan a group, so which people I am going to invite. So this could be very clearly, but it also could be possible to use just when you start the intervention with a kinship foster family, or also a foster family, just to know about predisposition to participate in a groups. So the tool also gives you some feedback. What happens with all of these individual, and this is the most interesting part, we build this thermal map to know what are the green, the yellows, and the red ones. And from that, we start this reflection about how they interpret with the profession, how they think about why this person is in green or in yellow or in red, and how they can help to them in a group setting, or if they are going to be part of the group or not. The second tool is the G keys, that also collect information about what happens in the group and what are the actions that the facilitator do to allow to develop all of these dimensions of the model. So this is also in that case, it's not it's more quantitative. So there are different statements that they decided if they are totally disagree to totally agree. And there are observational statements that are related to the things that happens in the group, or that actions that the facilitators did. And what also helps to the professionals is to have to realize the changes that happens in the group, because they used in the middle of the implementation of the program and at the end of the implementation of the program, so they can see what happens. And we also talk with them to try to identify why they think that this happens. And the interesting thing is that with if they has this feedback in the middle, they can introduce new actions to develop the sides of the model that they are not developing. Finally, so we are working now in the evaluation of these tools from the empirical implementation, and also to understand how these factors of the model are working. But we also wonder to know if these interventions are connected or help to the families and the youth to be more connected with the communities, as well as to provide guidelines. As you can see, the way as the objectives are written are in a colloquial way, because we also present to the families and also to the youth the research to understand why they are participating in the research. So we are in the middle of this design, doing implementation of different groups and collecting information through the process. An interesting thing in this collecting data is the reflexive practice that we are doing with the professionals. So we train them initially in the core model, the support programs, the how to implement, and also in the collaborative action research. And then we did 4 different sessions with them regarding to the reflexive practice. The first one is with the P keys, and the second and the third and fourth. So the second session and the third session as regarding to the G keys. And finally, we also did the last one regarding to outcomes, community, and also intersectionality. We finished 5 groups with 1 council in Catalonia. And also and this is really, really important, because it's also in the last one, the recognition of the participation, but not only the recognition of participation of the professionals, also of the families who has been participate. And we call to the politicians to come to give the families a diploma of the participation, and we give them back the results of the research. So challenge for the future, many challenges, of course, doing all of this implementation and evaluation, trying to find these relationships and integrating the different data, because there is a mixed method design. Explore more the intersectional approach, because we think that in Kinship this is really, really relevant. And the last one are the implications for the practice. As a social challenge, we've got to have to contribute to this strategy that it's involved. It's mandatory in Spain. So to the 2030, the reduced number of children in residential care should be a reality. And to finish, just to have this that I like so much, Martí Pol, it was a poet of Catalan. He said, now is tomorrow. I think when we think about children, we have to have got this in mind. So thank you. And I don't know if we have time to talk. Sorry to take so much time.
No, it was absolutely perfect. We are delighted for your presentation. Thank you ever so much, Nuria. I'm wondering, we have 5 minutes. Apologies for there is some problem with my sound. I'm wondering if there are any questions.
Too much information.
Any questions?
I've got a question. It's very interesting on that presentation about the group work and the development. You're designing and developing interventions and designing and developing tools and talking about evaluation of those tools. And I wondered, partly as a segue into what we're talking about this afternoon, but when you talk about evaluation, what do you mean by that? And what are your views about how to do it well?
So the tools that, so one of the, at the beginning I said the one of the focus of the research is to do applied research, because we are in the educational field. So of course we have to build knowledge, but for what? So our aim is also to make better lives of children through professionals' interventions. So we build the tools by a systematic research and also in a process of co-production with professionals. So the design of the tools, it is validated through this process. But we know that this is theoretical. So what we want to, or what we are doing now is validating through the empirical process. That's why we are doing this. Well, also, I think, I don't know if Julie is here, but we are not using the cognitive interview, but we are doing something similar also with this process of reflective. So we are collecting information from professionals through this reflective practice of the tools, and how they use, when they use, how they feel, what the outcomes. But we also have the qualitative and quantitative, so we are also going to run the others. So that's in that sense, this is. Both programs has been also orientated to evidence-based. So they've got, so that there is a design of pre, post, and also process. So the professionals collect data and also the families assess themselves before to start the intervention about their competencies regarding to take care of the children, and after. And so a part of this, we also collect data regarding the process of implementation of the programs. So we've got the information from the tools that the aim is to increase the quality, but we've got the information of the results or the impact in the people who has been participating in terms of changing their competencies. So I don't know if I answered the question.
Very helpful, thank you. We're talking about both co-production,
yes,
with professionals being important, and mixed methods,
yes,
essentially, but with before, after, and what's your? I mean, are you testing in large samples? What's your view about the randomized controlled trials?
This is another question, because what is a large sample for 4 hours? Yeah. Because as I told you, that it's a process that it takes a lot of time, and to every group, it's like a party because you have to train the professionals, and then the professionals should do the training, and the groups are small sizes. So at that moment we have a sample, but so So we are running not only kinship groups, we are also working with biological families their children are in need. We want to have also families who will be in the united process. So with all of this information, we will try to validate the tools from address to the different. But the numbers are not quite big.
Yeah.
Because they are not quite big at this. And that also could have some problems from the quantitative point of view in some point. But as we've got the qualitative, so we also have this validation.
Yeah.
So we expected that with the triangulation, we will have it. So
it's a fascinating answer. There's a lot of other questions I might.
Because it's really, if we expected to have 1,000, we are not going to want to have 1,000 at least. So we validate the tool. Because the idea is also to have this tool validated and given as a open access. To open access, and then continue collecting data, and then we will have this big sample, but not at this moment. At this moment, it's not possible. So
when you funded to develop, was it a research funding?
It's a research funded by the Ministry of Spain. So we've got these calls that is research, research and development calls. It's a research for 4 years. So we are now in the second year. So
was that specifically for this intervention or for general? And then you decide.
It's general for all the science.
Yeah.
So we are really happy that in all the science with physics, chemistry. So
others, we've got 5 minutes.
Thank you. We are currently past the time. I would just like to thank once again Nuria for
we can carry on afterwards.
One moment.
Sorry, Vanya, we've got one more question in the room. Sorry. Vanya.
Okay.
We'll do one more and then we'll come to you to close. Thank you.
This isn't actually about the groups and all that stuff. But right at the very beginning, you said that in Catalonia, certainly, that kinship carers must meet appropriate conditions for all foster carers. Is that right?
Yeah.
Did I misunderstand?
Les persones que estaven acollint, les famílies acollidores han de tenir un requeriment, o sigui, tenen unes condicions per ser.
Yeah. Sorry. No, I just wanted to read yes. No, yes. So what happens is that many of the kinship placements start before the assessment of the family. So I think that this is not new. It's in all. But to be recognized and not to be recognized. So with all the specialized teams and the agencies, so what did is to assess the family. So they should have this. Yes. So answering to your question is yes. They need to have this requirement that meets the needs of the children. So yes, all of them. So it couldn't be a child in a kinship foster family that don't meet the needs of the children. And also the families receive the support of these teams in the supervision. And what we are trying to is that not only in this kind of supervision, that sometimes is more like a control than a help, also with the groups.
We found that, in fact, that aspiration isn't met, so that kinship carers in a study that I did in England didn't in any way meet the same levels of competence or whatever as foster carers, and indeed kinship was very poorly defined. So you could be a very distant relative and slip under the bar because you were a relative, even though you were previously not known to the family. I'm interested if you have those issues.
But this is so. This is what you said. It's like what are the standards that the professionals use to decide if a family adequate or not in non-kinship foster family? It's like this is why it's good enough. They've got these standards, but these standards they don't apply directly to the kinship foster families because they are in another situation. That's why they also do this assessment, but not with the same standards. But does mean that the standards are not enough to take care of the children? No, they should be enough. But the question is that how, with the situation of the family, you can work with the family to be sure that that this kinship placement is it's adequate for the children. So, but there is, because we don't have, and this is a real problem, because we don't have a standardized assessment for the foster care. We don't have, and this is a real important. And the second question, Harriet, was.
We found that kinship was poorly defined.
Yeah.
So it's not just your grandparents. You know, that they could have somebody who was barely related to the child, but if they were related, then they had a lower standard.
It is the same, and this is also another tricky of kinship, because we are talking that kinship makes continuity, at the end, and also this told some youth people told us, for me it was someone who I didn't know. So it is the same that to be placed in a non-kinship, because the links hasn't been built before. What we also have the possibility is to include in the kinship those people who don't have blood links, but they have been experienced cohabitation. For instance, the partner of someone who are not the, and they can consider as a kinship. But I think that also this is a real same issue. Same issue. Thank you, Harry.
Thank you. Vanya, back to you.
Thank you so much. I will now just give the final thank you. Thank you ever so much, Nuria. It has been a true pleasure to listen to your research and the work that is being done in Catalonia at the University of Barcelona. Thank you everyone for joining, and please keep following us on our newsletter, and more webinars will be advertised very soon. So thank you everyone. I will then close the session. Thank you.